Thailand has a thriving medical tourism industry. For a fraction of the price back home, foreign patients enjoy 5-star facilities in private hospitals. Many of them come for treatment and then stay for an exotic vacation to recover. But healthcare for most locals paints a different picture. Critics say private hospitals drain much needed resources from the public sector, with medical tourism perpetuating the problem. I'm CHOU. On this edition of 101 East, we explore the disparity in Thailand's health services between those who can afford it and those who can't. In 1972, hoping to overcome the limitations of the public health system, a group of doctors founded Bangkok Hospital, Thailand's first private medical institution. Today, it is the flagship of the country's largest hospital chain, Bangkok Dusit Medical Services. In the past decade, it has been at the forefront as Thailand developed a lucrative medical tourism industry. The selling point, well-equipped hospitals with skillful practitioners offering quality healthcare, costing far less than in developed countries.
I have to say that it's something we cannot resist it though. Like for this headquarters here, 31% of our income are from global medicine.
Medical tourism in Thailand attracted 1.5 million foreign patients last year. Among them, Ali Salim Al-BULUSHI from Oman. He first came for an operation to remove kidney stones a few years ago. Since then, he has returned for 2 more operations and regular health checks.
والله أول ما وصل بانكوك تجينا سيارة من المستشفى.
The hospital provides very good service, like airport transfer. Once I arrive, the service staff shows good hospitality. The Arabic medical service has translators and good doctors. It's very impressive. The doctors diagnose well. There's a big difference between the doctors in Oman and in Thailand. My son-in-law had an illness. He went all over Oman, and no one could tell him what was wrong. When he came here, the doctors identified his problem within 2 days. He took the medication and recovered. Doctors here are more skillful and experienced.
But for many foreign patients, perhaps the best part in medical tourism is the tourism. Ali Salim Al-BULUSHI's preferred place for treatment, the Pattaya branch of the Bangkok Hospital Group. It's located near a popular seaside destination. With his relatives and friends, they stay on after their health checks for a vacation, sometimes up to 3 weeks. It is, after all, something different from back home.
Where are you from?
I'm from Maine.
Where, Maine?
Maine, Brunswick. Brunswick, Maine.
Oh, very good, very good, very good. Much. السياحة. أتمشي في باتايا في بانكوك.
For me, Thailand is a great place for medical treatment. Everything is cheap compared to Oman. Hotels are cheap. There's Arab food and it's good and cheap. So every 6 months, I come for a medical checkup and a holiday. I enjoy the facilities and all the tourism activities you find in Pattaya. Sometimes I also go to Bangkok to shop.
Medical tourism is part of the lucrative private health sector that entices physicians to leave public hospitals. Dr. Ekachai Paksuwana is a private ophthalmologist in Bangkok, taking care of both foreigners and local patients who can afford it. As a young doctor, he spent 8 years in public service, also moonlighting in the private sector to supplement his income. Sometimes the long hours affected his performance.
Very tired. I go out to work very early, 5 o'clock in the morning, come back at 10. Sometimes 3 days in a row. I don't see my family.
I went to see an orthopedic.
He says even today, that's common practice among doctors in public health care.
You know how much they pay a doctor for? Very little. not enough to pay for even the renting a house, pay off the car, school for children.
Doctors, like lawyers, like anybody, move towards the area where they get a better remuneration. That's simple. If governments want to reverse brain drains, then they have to do something about the salaries that are being paid for doctors in the public sector.
But it's not just the salary. Some of them say it's the satisfaction of working with the latest and the best in medical technology.
I spent 3 years working in the government hospital. I work as a general practice or practitioner, so I take care of everything. I have a really good experience, but you have dream. Now I dream to be an eye surgeon, and not just the eye surgeon. Now I want to learn the new technology and modify or adapt the new technology. Need to have the patient who can afford this cost and have a requirement.
If you are in the hospital, like in province hospital, you cannot treat the patient until everything is very good for them, everything is finished. You can treat only partially. You cannot give this medicine because it's very expensive.
To see what healthcare in rural Thailand is like, we travelled 6 hours northeast of Bangkok into Isan. Deep in the region is the province of SISAKET, near the Thai-Cambodia border. Here, poverty provides a stiff test for the public health system. Nguyen Lap Kosa is partially blind due to diabetes. For her and most of the Thai public, medical treatment is free. The government pays their bills under a universal coverage scheme using public revenue. But the high level of care she needs is a luxury neither the government nor she can afford. Now 60 years old, she lives alone and relies on neighbours for her basic daily needs.
I can't do anything at all. The neighbours tell me to stay put. They bring me food every day. I wanted to go buy some vegetables nearby, but I couldn't. My body aches so much, I can't lift my arms. I also have high blood pressure. My life is sad. When I get stressed, everything goes wrong. I once fell and didn't know what to do. I fell on this charcoal stove and just laid there. Luckily, the neighbours dragged me out of the fire.
She considers herself lucky that one of her neighbours works as an assistant nurse in a district hospital nearby. RATT HONGCHART helps with her daily insulin injections.
I feel fortunate to have RATT's help. She really takes care of me. And when she's not around, her sister does. I used to be able to inject insulin myself, but these days I can't see too well. I feel bad having to rely on them so much.
People like RATT provide an important link between remote villages and healthcare. Starved of skilled medical personnel in such areas, the government hopes to recruit hundreds of thousands of medical volunteers.
I help people in the village for many minor problems, like cough and fever. I teach them basic medical knowledge and perform simple first aid. It's great to be able to help using what I learned from my work.
In Pusing Hospital where RATT works, the lack of human resources means greater responsibility, even as a nurse aide.
จริงๆแล้วคือทำในคลินิกนะบทบาทหน้าที่จะไม่เยอะเท่ากับ
When I worked as a nurse aide in Bangkok, my role there was nothing compared to what it is in Pusing Hospital. Back then, I just needed to listen to the doctor and follow instructions. Here, doctors ask for your opinion, and I have to advise villagers too. There is a lot more work to do.
A lot more work with a lot less resources. That's why it is compulsory for young doctors who graduate from public medical schools to serve 3 years in rural provinces as payback for their education. Dr. THAYWIN ARTIKANKUL is a recent graduate. He arrived from Bangkok 2 months ago and already feels the strain.
เป็นในบางครั้งครับผมบางครั้งก็เรารู้สึกว่า
One obstacle is the lack of important medical equipment. If we were better equipped, we could treat the patients here in the district hospital. But now we have to transfer many of them to the bigger provincial hospital. This causes overcrowding. They ask why we keep sending patients over. There's no choice. We don't have the right equipment for the job.
Dr. THAYWIN plans to return to Bangkok after his 3-year stint to be close to his aging parents. He says he is likely to stay in the public sector, but knows most young doctors don't feel that way.
Of course, in private hospitals, there are fewer patients a day. They are mostly educated, so it's much easier to communicate with them and provide good treatment. Fewer patients also mean less work.
Within the private sector, Thailand rakes in more than $1 billion a year from foreign patients alone. That's about 35 billion baht, money that a developing country better known for its rice exports cannot afford to ignore.
I think $35 billion, how much rice we have to produce to send all around the world. Now I would say only not more than 12 hospitals in the country are doing just that for $35 billion a year. I think it's worth it.
From those hospitals, fewer than 1,000 of Thailand's 40,000 doctors attend to global patients. But the government aims to achieve a 10-fold increase in revenue from medical tourism by 2014. It begs the question, how much more will it deplete the public sector of its human resources to hit that growth?
Number one, you're always going to have private system in Thailand. Number two, global medicine is globalization. You cannot resist it. So number three, what you want to do with it, both private, public, the whole country should come down and try to solve that.
After the break, we look at the other key factors behind the public sector brain drain. The people who sacrifice personal welfare for public health care. And we ask, who pays the price? Stay with 101 East. It's a big night for the residents of Pusing district in Thailand's northeastern province of SISAKET. Dr. Kittipom Chutasmith from the local community hospital has just been named the country's outstanding rural doctor of the year. To celebrate, a party is being held on the grounds of Pusing Hospital.
สวัสดีครับผมเชิญนะครับ
Born in Bangkok, Dr. Kittipom never experienced rural life until he was assigned to work here in 1987. His commitment to public health care in this remote area is well known.
The real problem out here is the lack of human resources, especially doctors in rural regions. There are enough doctors in Thailand, they're just not evenly spread across the country.
Based on figures from recent years, the doctor-to-patient ratio in northeast Thailand is nearly 1 to 7,000. That's about 10 times the figure in Bangkok. Now the government is trying to aim for a scenario of one doctor to every 1,500 patients. But out here in the rural areas, that seems like a long way from happening. The workload in Pusing Hospital is not for the faint-hearted. It takes care of more than 50,000 people in this district. Assisted by 2 interns fresh from medical school, Dr. Kittipom is one of only 2 permanent doctors.
They have a lot of work. They have to see patients, more than 200 patients during the day, and then they work more than 80 hours per week. Normally work 40 hours, and very low payment and no welfare.
Physicians serving public health are paid fixed salaries. Those in remote areas have an additional allowance, but it still doesn't match their peers in the lucrative private sector. Faced with longer hours and a heavy workload, many of them leave public practice. Thailand's Medical Council says free public health care, introduced in recent years, perpetuates the problem.
Nowadays, we have a universal coverage. Patient can go to see a doctor free of charge. They can come anytime, even 1 or 2 o'clock in the morning, and don't have to pay anything. No matter you're rich or poor, you get free of charge. And people demand more, want to get the best because they don't have to pay. If they have to pay, they will calculate whether it's worth to doing that or not. But if they don't have, they demand a lot for the doctor. If they have very high expectation. If you don't satisfy with that, they will sue the doctor.
When you go to the public hospital and they don't have enough equipment and everything for the patient, and when you fail to deliver the work, you go to jail. That's the thing that drives the doctor to private doctor. Not the money, the jail.
In Pusing Hospital, Dr. Kittipom remains undaunted, but he hopes to see improvements.
We need specialists to be in smaller community hospitals like ours, so we can give faster treatment for patients with serious problems. Then they won't need to wait to be transferred to the provincial hospital, which is so congested. This patient has a certain strain of malaria. It causes him to have very low blood pressure. Yesterday, it was so low we wanted to send him to the provincial hospital to see a specialist, but he refused. His family members couldn't afford the travelling expenses to take care of him.
"70 kilometers away is SISAKET Provincial Hospital. For those who are admitted here, this is what they find. Hospital wards packed to the brim, beds even in the lift lobbies.
The big number of patients definitely affects the quality of our services. Nurses here don't work 22 days a month. They work every day because we need them. Of course they become exhausted and it affects the quality of healthcare.
To improve healthcare, the government is pumping in money to upgrade and expand some provincial hospitals, including this one. But the main problem here is the lack of specialists. Many of them are reluctant to work in the provinces. SISAKET Hospital has requested the government to grant their doctors scholarships to train as specialists and return to serve in the hospital.
The problem of brain drain is not new. In the past 10 years, lots of public hospital doctors have left for the private sector. The Public Health Ministry knows there is a problem. It is offering better incentives for doctors in the public sector. Hopefully things will not take too long to improve.
In the meantime, some in the private sector are already assisting public health care. The Bangkok Hospital Group shares its emergency helicopter evacuation service. Today, it is training medical staff and volunteers in the provinces on evacuation procedures.
We are willing to take payment from the universal coverage scheme, which is around 1/4 of what we'll get from our private patient. And we'll take them from one hospital to another hospital, any hospital. the hospital that are taking care of global patients, we should make them be responsible to things they drain away from teaching, training, and research job in the government.
But the situation could get worse before it gets better. One of the biggest sources of income for public hospitals is from civil servants' medical benefits. But this revenue is about to be slashed, with the government now allowing civil servants to use some of their benefits in private hospitals. Bad news for the more than 800 state hospitals here, 2/3 of which are already running at a loss or operating with no reserves. It seems public healthcare problems go way beyond the public to private sector brain drain. Today, some say medical tourism, with its high-quality services, might actually provide a silver lining by raising standards.
I call it, as a doctor, as osmosis of quality from top-tier hospital to the second-tier, third-tier hospital. So Thai people get benefit from that, because we can serve the government that way. For example, for our universal coverage patients, when they have emergency for heart attacks, our network hospital will take those patients to our hospital, and they don't have to pay. Like last year, we took care of 64 cases.
That's a drop in the ocean compared to the number of cases the public hospitals struggle with every year. But every patient saved is one less in the queue waiting for treatment.
There's not enough time for patients to queue up. Sometimes lives cannot be put on queue.